our dear members. Good morning to all our dear members, and I'm Dr. Anupama Gotimukula, President of AAPI. And as you all know, we have been doing CMEs every month on the second Saturday, except the January month. We couldn't do it because of the Global Health Summit. We were all in India. So that got skipped, but we are trying to maintain this timetable all around the year. Every second Saturday of the month is the CME, 2 hours of CME. And this year, API has done a bunch of CMEs outside these monthly CMEs, like Tanzania trip, we did 1 CME, and Global Health Summit, we did 6 hours of CME. And we have convention coming up, which will be another CME for API members, which is coming up in June. And I would like to welcome today's speakers. We have outstanding speakers who worked on this field for many, many years. And me being a pediatric anesthesiologist, I come across many kids with autism and autism spectrum of delays in developmentally, and we see them every day in my career, daily life. I have these kids coming up, but it's a question for all of us, like why this happens. So we have 2 outstanding speakers today, Dr. Sunny Anand and Dr. Mina Shintapali, who are experts in this field. And without much time, I will have Dr. Amit Chakravarti, our CME chair, moderate the session today. Thank you, Amit. Unmute yourself.
Yeah, so thank you so much, Anupama. Again, like she said, that we do the CME second Saturday of each month at 12 o'clock Central Time, and except for this last month we missed, and we're going to continue doing that. I was just speaking just before we came on the air that we like to do the CMEs. This year we've been doing out of the box CME, not specialty related, so that all physicians, despite which specialty they are, they can join, enjoy, and learn from these things which we don't get to encounter in our day-to-day CMEs, which we attend on our own profession. So today we are very, very honored and privileged to have 2 awesome, very distinguished speakers who will speak on something which is completely out of the box, but still very, very, very interesting, and all of us should know about these things because we encountered these challenges in our daily life. The topic of today's session is causal triggers of lifelong physical and mental health challenges. And to speak, we have got 2 speakers, Dr. Kanwaljit Sunny Anand and Mina Shintapali. First, we'll have Dr. Anand to start the session. Dr. Anand is a professor of pediatrics, anesthesiology, perioperative, and pain medicine. He's the director of pain, stress, neurobiology lab at MCHRI and director of Jackson Vaughan Critical Care Research Fund and Department of Pediatrics at Stanford University School of Medicine. Dr. Anand is an extremely pleasant and great to. I enjoyed communicating with him. We first started this process when he was actually in India, in Amritsar, and we have got this thing down to a T. His topic today would be how the social ecology in early life shapes the trajectories of health and success. So I'm just cannot wait to start and hear him speak on this wonderful topic. Dr. Anand, you are on.
Thank you. Can you see my slides?
Yes, we can.
Yeah. Okay. Thank you. I'm Dr. Chakravarti, Dr. Anupama. I'm so honored and delighted to be speaking with with all of the API members who have joined. And this is really the passion of my life. I've been in practice for about 40 years. And, and I'm coming to realize towards the end of my career, possibly, how important is the work that we do as pediatricians, but not only that, the work that we do as parents, the work that we do as community members, and how we can have a major impact on the early life of children and shaping their trajectories for health and success. So without further ado, I'll just launch into this cartoon, which shows the yin and yang of early childhood. On the one hand, children are characteristically hedonistic. They seek pleasure, they support, they love interactions and play. They get a sense of security in a family. But there are some children that, because of medical reasons or social reasons, may experience pain or stress, neglect or isolation. They develop this sense of insecurity, and they're exposed to adversity. And this was encapsulated very nicely by Bronfenbrenner. Eri Bronfenbrenner was the person who started the Head Start movement in the US. And he put out this ecological systems theory where the individual is surrounded by the microsystem, which interacts through the mesosystem with the larger exosystem. And all of this is embedded within a macro system, the attitudes and ideologies, where we live. And this is dependent on a chronosystem, which is, the social historical conditions. So the AAP had decades ago recognized that there are lifelong effects of early childhood adversity and toxic stress. And they came up with this cartoon, which shows that how biology interacts with health and development through neuroscience, and ecology interacts with biology through epigenetics. But only recently have we started working on how ecology, the social and physical environment, interacts with health and development through this new discipline called life course sciences. And this is what I will focus on. And just think about this child, how her biology is influenced by the ecology, and how the ecology then leads to changes in health and development, learning and behavior. So as we all know, adverse childhood experiences has reached an epidemic proportion in our country, or even across the world. The original ACEs study that was done by the CDC and Vincent Felitti and Robert Anda identified these 10 types of adverse childhood experiences. They were associated with either physical, emotional, or sexual abuse, neglect, physical or emotional, or dysfunction in the household, like mental illness, incarceration, domestic violence, substance abuse, divorce, etc. But there are other community factors since then we have learned that contribute to the toxic stress experienced by children. These are poverty, structural racism, historical trauma, war, migration, etc. So the ACEs study showed that if you're exposed to 1 to say 5, one or more adverse childhood experiences, you have a 5-fold increase in your risks for developing depression. Similarly, for ischemic heart disease, if you're exposed to multiple adverse childhood experiences, more than a 3-fold increase in ischemic heart disease. Similarly, with alcoholism, there is a 16-fold increase in alcoholism, a 35+-fold increase in the use of illicit drug use. And this is, resulting directly from your adverse childhood experiences. So to summarize the ACEs study, those who had 4 or more childhood adversities had 4 to 12-fold higher risks of drug abuse, alcoholism, depression, suicide, 2 to 4-fold higher risks of smoking, poor health, sexually transmitted diseases, higher incidence of physical inactivity, obesity, and then there were linear correlations with all of this. This is from a meta-analysis of the findings across many different studies that looked at ACEs. So really, I've already pointed out what is childhood adversity. And to put this into context, we must realize that abuse or neglect can be of many different types, not just what Vincent Felitti had identified, but it could be physical, educational, emotional, like ignoring, rejecting, isolating a child, verbal assaulting, terrorizing, corrupting, or exploiting children. There could be different types of household dysfunction and neighborhood and school dysfunction, like bullying, delinquency, crime rates, pollution, etc. So there are a host of studies that have linked these direct health effects of early childhood adversity, not just in adulthood, but throughout childhood. You have impaired physical growth, cognitive development, delayed menarche, physical health problems, sleep disorders, cancer, heart, lung, digestive issues. Mental health problems are very, very significant. And then there is an increased vulnerability to improper sexual behaviors, domestic violence or interpersonal violence. So what we did was we looked at 100 patients who were coming to our clinic, and these were children who were 5 years or older, who had 4 or more unexplained symptoms for longer than 3 months. And we assessed these children for executive function, sleep, autonomic dysregulation, somatization, which I'm sure you're familiar with, the physical from mental stress or psychological stress, digestive systems, emotional regulation, etc. We found 100% of these children had somatization, sleep disorders, and emotional dysregulation, and a vast majority had abnormalities in all the other 6 domains. And in fact, we found that children who had 4 or more unexplained symptoms, this is after multiple testing, many clinics, many different evaluations, they had a much higher incidence of having, this syndrome. And we call this the advent of nervous system dysregulation, which results from adverse childhood experiences. Here's the chart. It's a nonlinear correlation of, the children who had 4 or more ACEs, and they had much higher incidence. This was significant. So we tried to search the literature, and we found that there's only one other thing that has been identified, which is called this chronic multi-symptom illness, which is unexplained illnesses in Gulf War veterans, very similar to what the clinical profile that we noticed in these children. And after we found that, we wrote up, this review article on what are the pathways that lead from ACEs to nervous system dysregulation, taking account all of these factors which form the social ecology of childhood. It impacts child growth and development into health-related behaviors, psychological adaptations, and physiological adaptation. And then based on the conditions that they're exposed to, there could be resolution, restoration, regulation, or they could be behavioral dysfunctions, emotional immune disorders, CNS dysregulation that results from all of this. And this helps to explain, the kinds of local problems that we have experienced in the Bay Area. School suspension, juvenile arrests, suicides, homelessness, et cetera, The costs from one homeless individual is $250,000 per year. And this explains also some of the national problems, again, similar types of school suspensions, mass killings, suicide rates, et cetera, et cetera. So the CDC looked at this and published this. They tried to come up with what is the proportion of adult health problems directly attributed to ACEs and the implication for prevention. And what they found was that the population attributable fractions by the ACE score overall were 12-fold higher heart disease, 24-fold asthma, 44-fold depression, 24-fold alcohol abuse, and lack of academic attainment increases. And so they have looked at this in a systematic review and meta-analysis where the ACEs attributable fractions in Europe and North America. The North American studies were 11 US and 1 Canadian studies. So they explain a total of 3.5 million disability adjusted life years and 1.3 trillion annual healthcare costs only if you take 4 of the health risks and 6 illnesses resulting from the ACEs. More than 75% of these costs occur in people who have 2 or more ACEs, which have a much higher prevalence in US and Europe. And here's another meta-analysis, for England and Wales. So hundreds of billions of dollars are being spent by government, charities, but they are focused on treating the problems after they have occurred. And I'm just setting this up for Dr. Shintapali's talk because she will show how a lot of this can be prevented. On top of all of this, the epidemic of ACEs in our country, we've faced the COVID-19 pandemic for the last 2 years. 1.5 billion children were confined to their homes where they had a loss of social activities, peer support groups, other trusted adults like their teachers or coaches or other. And they were exposed to the same mental illness, substance abuse, neglect, or parent discord. Even the parents had a major impact, like social isolation, burnout, alcohol, drug abuse, shot up during the early days of the pandemic. There were fewer options for positive childhood experiences, and prospective studies actually showed increases in physical and sexual abuse, psychological abuse, and things like that. And so we are now sitting on a time bomb about to happen, where the toxic stress that was caused by this pandemic will manifest in the next few years and decades. So it's relatively easy to measure the outputs of early life adversity, and that's been documented by many studies. But how do we measure the social and emotional inputs in this vulnerable period, particularly among children who are nonverbal, who may be shy and don't want to speak up in front of a stranger? They come from unpredictable environments. They may have unreliable historians with them. Particularly, how do we find time-scaled objective measures that are relevant to biology and behavior? So there is this measurement problem. And in my lab, we decided that any negative experience will lead to stress, which may cause cortisol release. And positive or socially affiliative experiences will cause, bonding, human bonding, and oxytocin release. So I looked at this, and this is something we came up with 4 years ago, how the oxytocin axis has a major impact in downregulation of the Hpa axis, or the stress response axis, and how it can reduce the negative impacts of cortisol and catecholamine release. But then we were stuck with this timescale problem. Cortisol response lasts only 15 to 20 minutes. Oxytocin lasts only 2 to 4 minutes. So these are very short-lived. How can we assess these experiences over weeks and months? So I was scratching my head about this and then hit upon the idea of how about measuring these hormones in the hair? Because hair grows at about 1 centimeter every month. And so in this child's beautiful long hair is the story of her last 1 year of her childhood. We know that circulating cortisol and oxytocin are bound to hair protein. And so we developed the most sensitive novel assays for hair cortisol and hair oxytocin, which are currently exclusive to my lab. We even published our cortisol methodology, and now this has become the standard method being used by many labs across the world. So when you look at the difficulties associated with getting specimens of, serum or plasma or blood, saliva, urine, which is very challenging in young children, I think in comparison, hair is non-invasive, can be obtained any time of the day, no effect of diurnal changes. No refrigeration is required, you don't need any sterile equipment or needles, and it provides chronologically distinct samples. So we measured hair cortisol, and we reported this 2 years ago, examining demographic and psychosocial factors in preschool children. This is what we found, is that hair cortisol significantly reduces during childhood. These are children who came to clinic at 1 year, 2 year, 3 year, and 4 years of age. And we found no differences in boys and girls, but we found big differences between children who were white, other, or Black, where the Black children had much higher cortisol levels, and they did not show the normal expected decline during childhood. Here are density plots showing the cortisol values, hair cortisol values at 1 year, 2 years, 3 and 4 years, and you can see that the curve is shifted towards the right for most of the Black children. This was published on the cover of Pediatric Research, and we gave the normative values of all children and the different races. But when I individually mapped out some of the children who had multiple testing, multiple hair samples, this is what their longitudinal trajectories look like. And I was puzzled. I thought, how can we analyze this data and make some sense out of it? Using latent class mixed methods modeling, we were able to find, for the first time in humans, we were able to identify children who were in the 4 phases of Hpa Axis Dysregulation. We found some children that were in homeostasis, some children that were hyper-responsive, some children that were failing to adapt, but still trying to adapt. And then we found some children in the exhaustion phase of Hpa Axis Dysregulation. And we published these, the 25th to 25th to 75th percentiles for, log normal hair cortisol values, in these. So this was sort of class 1 was our acute stress conditions, homeostasis, which is adaptive, resistant, maladaptive, and dysregulated. And this has just been published recently in the Frontiers in Pediatrics on the longitudinal trajectories. Similarly, we've looked at hair oxytocin in the same hair samples, and this is what the initial plot looks like. But when we look for differences, yes, males have higher oxytocin levels than females. This was quite a surprise. But then we found similar differences. Other races have higher oxytocin level than African-American children. This is all in the preschool age group. We did a molar ratio of the log normal cortisol to log normal oxytocin. Didn't show any trend, and these were the mean standard deviation box plots. But when you map this out, you can see it follows almost a normal distribution curve. So this actually we are proposing may have a significant biological impact. We find that this ratio increases with age in the higher SES groups, but it decreases with age in the lower SES groups. So we have come up with this set of hypotheses where if you have a high oxytocin and a low cortisol, then we expect this child is in a nurturing environment, they have stable and consistent parenting. But if you have a low oxytocin and a high cortisol, then you may have adverse parenting or a parent history of ACEs, etc. But if you have a low oxytocin and a low cortisol, this is severely adverse parenting with dysregulated Hpa axis. And we are currently publishing data or analyzing data to try and prove or disprove these hypotheses. But what about positive childhood experiences? Does that have any impact or importance? This was a study that was done in Wisconsin, where they looked at mental and relational health. And they took all comers in Wisconsin, and they found that if you have no ACEs, 1 ACE, 2 or 3, 4 to 8 ACEs, particularly the 4 to 8 ACEs, you have a fivefold higher incidence of adult depression and poor mental health. But this is ACEs in the absence of any positive experiences. But when you start adding, the very few positive or more positive experiences or more positive experiences, you find that this vulnerability decreases. And this has been shown in a number of other studies that have looked at ameliorating the biological impacts of early childhood adversity. And there are different interventions. I think the most powerful intervention is the one that Dr. Shintapali will talk about. There was another study published on the influence of adverse and advantageous childhood experiences during adolescence on young adult health. This was from the Flourishing Families Project. They took about 500 adolescents who were 10 to 13 years of age, and they assessed them at baseline and then followed them up 10 years later when they were 20 to 23 years of age, and they assessed these domains. They found that those who had, mean level was 2.7 ACEs, mean level was, 8 positive childhood experiences, and these were negatively correlated. So more ACEs, less positive experiences. The ACEs were associated with risky sexual behaviors, depression, anxiety, and substance abuse in the young adults, whereas the positive childhood experiences had a negative correlation with all of these outcomes. So when you took a ratio of ACEs to positive experiences, it was predictive of less risky sex, reduced depression, less substance abuse, more positive body image. But there was no change in anxiety. So the greater the number of positive experiences compared to ACEs, the better is their health outcome. This tells me again is that the oxytocin to cortisol ratios in hair may be having some physiological advantage. So here's a child who's growing up, in the fertile soil of a family, who will, soon be ready to go to school, and may experience adverse childhood experiences or positive childhood experiences. We know if she experiences repeated stress, it will weaken her prefrontal networks, and resulting from molecular insults to higher cognition. What happens is that when you have adverse experiences and exposures to stress, then this is the stressed brain. And what happens is that there is reflexive and habitual responding from the primitive brain circuits, which activates the autonomic nervous system and activates the Hpa axis. And you have a shutdown of your prefrontal cortex. But if you have positive experiences and fewer stressful experiences in childhood, then you have a top-down regulation of the brain activity through the prefrontal cortex, where thoughts, emotions, and actions are pre-mediated by those experiences. And this has been shown in a very beautiful way in this systematic review. There's also another study showing that ACEs during early childhood can predict your academic attainments at 7 and 11 years. This was a birth cohort study. So coming to the conclusion, my friends, we are what we think. All that we are arises from our thoughts. If we have positive experiences and positive thoughts, that will lead to positive health behaviors and greater success. And this is a cartoon that I've made up, where the child is being exposed to these positive or adverse experiences, but there are parent factors, neighborhood effects, social determinants of health, etc. And they can be buffered by, parenting skills and warmth, faith groups, playgrounds, etc. This will lead to typical behaviors, regulated emotions, executive function, etc., and adult outcomes that are promoting healthy behaviors and good health. Whereas the cortisol release and these adverse factors lead to atypical behaviors, habitual, impulsive, externalizing or internalizing behaviors, attention deficit, anxiety, etc., leading to these adult outcomes that we see every day in our practice. So the social ecology of childhood strongly affects our capacity to be healthy and successful. It starts with the adversity, disrupted neurodevelopment, social, emotional, cognitive impairments, adoption of high-risk behaviors related to our health and our cognition, and then this is disease, disability, social problems, and early death. So these are the mechanisms by which early childhood adversity plays an important role. To simply conclude, there is an increasing prevalence of ACEs, which has been accentuated by this pandemic. There are lifelong effects on mental and physical health, educational attainment, socioeconomic outcomes, criminal or risk-taking behaviors. ACEs can certainly be countered by positive childhood experiences through nurturing care and multisensory integration. Hair cortisol and hair oxytocin, at least I think, may be biomarkers for negative and positive childhood experiences. And this is the ecology, the social ecology of early childhood, gives the context for social emotional learning and future success. So I will leave with this poem. This was written under the pen name of Gabriela Mistral, who is a Nobel laureate for literature. She said, "The child's name is today. We are guilty of many faults and errors, but our worst crime is abandoning the children, neglecting the fountain of life. Many things can wait, but the child cannot. Right now is the time his bones are being formed, his blood is being made, his senses being developed. To him, we cannot answer tomorrow. His name is today." And today, my friends, let us make a change and remove the adverse childhood experiences, increase the positive childhood experiences amongst all of our children, not only our own, but in our temple, in our gurudwara, in our church or synagogue, in our community, in all the clubs and groups that we belong to. Childhood really needs to be fortified and saved from the ravages, current ravages of our society. Thank you very much.
Thank you, Dr. Anand. That was a wonderful eye-opener. Great talk, as I didn't expect anything less, seeing your absolute passion about this subject, and you've been, it's great for us. And we've got a lot of questions from the audience, and I'm going to just ask them, and if you could please answer those questions. The first one is from Dr. Hunasikati. He asks, is structural racism similar to intercaste and interreligion conflicts in Indian situation during childhood?
I think the two things are very different because structural racism is sort of founded on the concept of slaves and slavery, and comes with a huge impact of the historical trauma that has accumulated across multiple generations. The intercaste, interreligious conflict in India has its roots in a different kind of ethos. And so there are different factors associated with that. I don't think we can equate the two. They are both very, very important, very significant as far as childhood and child development is concerned.
Great. Thank you. Dr. Chidambaram asks, could you please talk about allostatic load measurements in relation to stress in children? I'm interested in epigenetic changes in stress genomics. Wow, that is a tongue twister.
And you did extremely well, Dr. Chakravarti. I think it's a very, very important. Allostasis, for those who may not be familiar with this term, is the cumulative impact of repeated or prolonged stress. So when you have exposure to repeated or prolonged stress, that creates an allostatic load, because it is your stress response system is migrating, it's modified every time the stress is related. And so what I showed with our longitudinal trajectories paper was the fact that there is the impact of allostatic load, and it is very likely that it will have epigenetic effects on the stress response system, but not only the stress response, on the perception of pain, on the the health behaviors, the choice of diet, the body image. All of those things are impacted by the epigenetic changes resulting from allostatic load.
Awesome. The next question is from Dr. Brahmanand Sharma. What are the new findings from neural connectome where their problems can be identified early and reprogrammed?
Yeah, and I think Dr. Shintapali will touch on this in significant regard. The connectome, the human brain connectome, is currently being developed and constructed through many, it was very much like the human genome study. So there are early results from the connectome, the neuroconnectome, in terms of the neuroimaging and neurophysiology that we have been able to identify. But which of those are affected by the stress response system, and how the neuroconnectome changes as a result of repetitive stress, and particularly the repair of those changes or resolution of those changes, is still up in the air. So it's an important area of research.
Awesome. Dr. Mithika Kanabar congratulates you about this positive outcomes research and comments that this is not very frequently discussed, and really appreciates you doing it. And a shout out from one of your classmates, one of our board of trustees, Mukesh Nigam. Apparently, you also do a lot of research in pediatric pain, and you are his batchmates, and he says hi.
Mukesh bhai, namaste. We must connect offline. This is so good. Thank you.
Great. So now you're a celebrity. You'll get a lot of calls from outside. Dr. Chidambaram, Vidya Chidambaram also asks, would like to understand how best to measure positive experiences and resilience in children, and how do you measure this in smaller children? Is it proxy from the parents?
Mm-hmm. Yes, so that is a major concern. So there are ways of measuring resilience through different questionnaires, and through looking at heart rate variability and the degree of parasympathetic and sympathetic tone. Particularly when you do a cold hand immersion test or things like that, how the heart rate variability, you can get some surrogate measures of resilience. When you're looking at preschool children, unfortunately, they don't have the cognitive capacity to understand what is resilience. And they also don't have the verbal repertoire that they need in terms of describing their emotions and feelings and things like that. And so, unfortunately, we are stuck with looking at either parents or preschool teachers, for examining resilience. You see, this is why I feel that the hair biomarkers that we have pioneered are so important. You can experience a lot of stress, but how much of that stress gets under your skin and has an impact on your psychology and your biology, that is going to be measured by hair cortisol. And how I hit upon hair oxytocin, I was just going for a walk. There was a playground, and children were playing, jumping on the swings and slides and so on. And there was this little girl, she was running and she fell down and was then crying. Other children were laughing at her, and and she was like totally shut down, totally like you could see that emotional phase of her. And then suddenly her, I assume her mother came up and gave her a hug and kissed her on the forehead, and within seconds, this child got up and started running. And it was this, I think it was like a Buddha moment. I said, what happened in those 5 seconds of interaction, that converted this child from this, fearful, shut down human being into someone who's exuberant and vigorous and vital, good vitality, and playing again. And that's when I thought about, it must be oxytocin. Because when the mother gave her a hug, mother releases oxytocin, the child releases oxytocin, and it shuts down the stress axis. And I think that is I think the powerful ability we have is by measuring the hair cortisol and oxytocin.
Great answer. Dr. Anand, we have actually a lot of questions. So if you can, we want to cover all the questions. So just maybe shorten your answers a little bit, but we will continue and we'll finish it, because this I'm telling you, I've been doing CME moderating such a long time. This has got more questions really than many of the other sessions I've been. So we've got 20 more questions down the road. Okay. So again, from your friend, classmate Mukesh Nigam, do these stresses last till adult life, and can we still measure it by hormone levels?
Yes, these stresses do last throughout the lifespan, and they shape how we behave in different situations, particularly when things are not going well. And so the measurement through hormones may or may not be possible. What I think can be done is to look at Hpa Axis dysregulation. And all of us, depending on what we've experienced, from our childhood up until today, are being molded by those experiences. And are, sometimes we have a very difficult period. We're going through a job crisis or things like that. At my previous university, I was exposed to, similar conditions, and I could see that my tolerance, my patience, everything was impaired. Even my creativity was impaired. So it has an impact on us. I think most of us who grew up in India, had many more positive experiences and nurturing environments than what the children have over here.
Awesome, awesome. Anybody who actually, I just to not to disrupt this, I'd rather continue the question and answer this way. Please post your questions on the chat box. Again, Bhavna Chabaria says that amazing. She was very fascinated to learn that hair cortisol and oxytocin level. I can measure that, and it's an amazing revelation. Dr. Maman said that excellent talk, as have several other people. A lot of people said childhood is the foundation. Parents, excellent. The parents also play a big role. A lot of comments on that. Parents are irreplaceable as nurturers during childhood. Um, Alka. Alka Patel asks, does emotional trauma to a female during pregnancy affect childhood experiences?
Yes, it does. Yes, it will do that. However, you see, there is, and we've shown this. We found that we published a paper in Psychoneuroendocrinology where those who had traumatic life experiences during pregnancy, their children had higher hair cortisol at 3 and 4 years of age. However, it's not a one-to-one. Basically, after the baby is born, if the mother is nurturing, they have a stable, consistent parenting, good environment, then those long-term impact can be completely wiped out for the child.
Awesome. Malika Kanyabar, by the way, there are some raised hands. And if there is time at the end of the talk, after Dr. Mina Shintapali's talk, we can have you guys come on. And so please, at the end of the talk, after Dr. Shintapali's talk, if you raise your hands, if you want to make a couple of comments, we'll be glad to get you on. How does spirituality do on this data for healing from ACEs? Many parents claim they feel better.
Yes, absolutely. I think a family that prays together stays together. We made a practice in our household of singing bhajans in our home. Every day praying together. Every week we had the community come, and I see that now my children are in their late 20s and 30s, and they show the impact of that. Very positive.
Our past president Jay Shah, our conventional chair, says nice presentation, Vidya Chidambaram says that this is so relevant to her research, which is on epigenetics in pain, and this is relevant talk for that, and she thanks you for that. Our old Dr. Veena Govila asks, are old physical and emotional traumas, are they treatable if recognized early?
Yes, absolutely. They're easily treatable. And I think Dr. Shintapali will talk a little more about that. But I know from personal experience as a pediatrician, where there was a terrible, terrible situation in childhood, and where the parents got divorced and so on. But later on, the child had a nurturing environment, and they were able to overcome all of the impact of their childhood trauma. My mother also, was basically, after we had left our home, she had a center for homeless children, only girls, and she showed how through just love and nurturing, understanding, and patience, those children could recover from their trauma. I've seen that firsthand many times.
Dr. Kamlakar Rambao asks, does teaching meditation in school have positive thoughts by virtue of improved clarity?
Yes, absolutely. And we are doing this study to show its impact on hair cortisol and hair oxytocin. We've just launched a study where we are teaching Sudarshan Kriya Yoga in 7th and 8th grade children, because these are pre-adolescent. And hopefully in a year's time, I can come back and show you the results.
Great, perfect. Does your research focus on addiction? Anything on those lines?
So I have not done any research on addiction, but there are many studies. Karen Hughes had published a meta-analysis in The Lancet couple of years ago, where she found, 4 or more ACEs had a major impact on addiction. And I also showed the drug abuse and the alcohol abuse data earlier. Yes, it does make, and it's not, we have data on drug abuse and alcohol, but it's also other types of addiction to video games, addiction to sex, addiction to, various kinds of vices that are associated with that.
Wow. Dr. Choksi also says, Tarak Choksi says that, it even happens in, it starts in utero. In other words, mother having addiction when she's carrying the child, that might also, that was his comment. And that's awesome. A lot of people have commented, made great comments here. Now I'm going to go down. We've got 24 more comments, but I'm going to just try. You really, this has been a rock star talk. I've had so many questions. Hang on, I know.
It's going nonstop.
Yeah,
all because of
I'm
my
not.
spiritual mentor.
You
Yeah.
can go with the next.
Yeah, I'm now trying to just kind of edit it. Like our studies being done on meditation in schools for parents and children to help prevent. While I'm doing this, thank you for this question. I'm going to do a pitch for our next month's topic, and it is on Headspace. It's absolutely on this meditation and stuff. So I will announce the details at the end of the talk, but because this came up, there's so many questions on meditation and it helps. So this is a perfect kind of a tee off for the next month's talk. So go ahead and answer that. Sorry.
So meditation does have an impact, different types of meditation. I've mainly looked at Sudarshan Kriya Yoga. And this is the yoga taught by, the breathing yoga taught by Sri Ravi Shankar. But also my friend Bala Subramaniam has looked at the inner engineering that is taught by Sadhguru Jaggi Vasudev. And so there are significant, we have almost 40 different studies showing in college students, in school students, even in primary school students, that meditation and mindfulness practices have a major impact in reducing the stress response and making these children more. Those studies did not include hair cortisol. That's why we are doing the current study right now.
Just a one-line answer. What does cortisol tell you? I mean, that somebody was asking that. What does this cortisol level tell you?
It is the repeated cumulative experience of stress is what the cortisol tells you.
Okay, great. Jyoti Jasti, she asked, she congratulates you for your excellent work and says that biomarkers to improve outcomes to raise happy, successful individual, there should be no stopping to include this in primary workup of childhood psychosocial syndromes. And I'm curious to understand the value of markers and undiagnosed depression in adults, possibly as a result of pharmacological therapies. Example, oxytocin spray, steroids, etc., for elevated cortisols and low oxytocin levels. What do you think about that treatment of therapy of that?
Yeah. So there are multiple questions in this comment. So let me just mention that yes, it is possible to look at psychosocial disorders in children. What I'm trying to do is, maybe at the end of my career, is hopefully the American Academy of Pediatrics says, with their regular yearly checkup, we take a small sample of the child's hair and send it off for hair cortisol and hair oxytocin. That would be fantastic, because that would then give a red flag as is something going on in this child's life that the parents may not be aware about. So that would be nice. Mental health and post-traumatic stress disorder, all of those conditions are closely related. Whether giving a spray, nasal spray, oxytocin can result in ameliorating depression, reducing depression, is still unknown, and that research needs to be done before something becomes like folklore and becomes widespread, because it may have unintended consequences as well.
Great. So Dr. Venkatraju says, excellent talks. Any studies on ACE levels in NICU graduates? Nicu graduates.
Good point. Yeah. So this is touching on my previous work, where I had shown, premature babies are repeatedly exposed to pain and stress during their NICU graduates. When we have looked at hair cortisol in ex-preterm children, they do have Hpa axis dysregulation, but it is quite variable. Because a child, there are some children in my practice who have gone home, and within a few years they are thriving, they are doing extremely well, and other children are not like that. They, in fact, their disabilities, their cognitive and hidden learning disorders increase over time. And I think it's because of the social ecology that those children go into. And I think Dr. Shintapali will expand on that, I hope.
So Dr. Chandra Kunaru is asking, are hair oxytocin and cortisol levels available for commercial use or only for research?
So right now, our methodology for hair cortisol was published, and I think we've trained at least 25 major labs across the world, from New Zealand to Africa to Europe to South America, everywhere. So we've trained a lot of people, and that is the method being used. We have not published the hair oxytocin methodology yet, because Stanford wants me to, file a patent. And so we've not been able, also it was difficult to validate. Yes, there are many labs that measure hair cortisol, but hair oxytocin is not currently available.
Great. So we've got about...
do a study and send me samples, I can measure both of those for you. But it has to be, you'll have to sort of pay for what it costs to measure them.
Awesome. We've got 4 more minutes. Ravi Kohli commented that Anna Karenina principle is so true. And I have no idea what that is, but I'm sure you guys understand what it is. And fantastic talk, says Sanjay Agarwal. Great analogies, correlation of daily lives in India and here. And we are going to, this talk will be actually posted in the AAPI website in a few days. So you can always have access to this talk anytime. A lot of people, there's Dr. Adapa who would like to collaborate with you, Dr. Pavani Adapa. How can I get in touch with you? We have his information right on the website, or you can actually text me and we can, or the API office, and they can get in touch. They can give his contact number. Anyway, meditation in schools. What do you think about that? Laughter is the best medicine, they say. What do you think about that? And there is a lot of groups in India who have fake laughter. They just go to a park and just, I've seen these videos online, and that's my personal question based on Dr. Morissetti's question, is that these people just go to the park and just laugh. What are these? Do they have any effect on the cortisol oxytocin ratio?
Well, it has not been mentioned, but a number of people who participate in these laughing groups tend to, have a reduction in their blood pressure, in their depression, and all of those things. Yeah, it does. I'm sure it's a positive reinforcement. It's a social bonding occurs during that time. Nobody's measured hair cortisol or oxytocin in those people, but I'm sure it does have a positive impact.
Great. Veena again asked, Veena Govinda, controlling parents are stressful for children? I'm pretty certain the answer is yes, but go ahead.
Yes, there is one study which showed that overprotective parenting or controlling parents, can cause significant degree of cortisol release, mainly measured by salivary cortisol. And all of the people who've asked to collaborate, I'm sending them, my email address so they can contact me.
Awesome. I've got one more minute. Has there been any correlation between sleep quality and your, the sleep quality and the stressors which I mentioned?
Yeah. No, I have not been able to do that as yet. But that is one of the ideas we want to explore, on association between sleep and the stress response system.
Great. So again, your email address, everything will be, if you don't mind, you can actually post your email address on the chat box, Dr. Anand, and that way they can contact you directly. And when you become rich with your patent on this thing, please remember us. AAPI would remember AAPI was a small part in getting you out there. But anyway, let me also thank you so much from the bottom of my heart. Everybody enjoyed it, and trust me, I've been doing the CME for the last several years actually, and last year I've been the CME chair this year, and I have never had so many questions. Anupama, I'm sure you'll agree to that. So many questions,
I agree
really.
with
I
you.
mean, this is I'm not just
That's the
kidding, just
topic.
because, yeah. So also, before I go for the next speaker, just wanted to put in a little plug in for the AAPI convention. We have got an amazing AAPI convention coming up in San Antonio. Dr. Jayasha is the convention chair, and obviously the president Anupama is doing it in her own backyard, and it's going to be an exciting we had last 2 years we had little subdued conventions because of the COVID, and this is the first time we'll have a full-fledged, full-fledged, hopefully no masks convention, and looking forward to it.
Masks are mandatory. So,
Masks are mandatory still?
yeah, I don't think we can get out of this COVID soon, but masks mandatory. But I think every one of you should plan to attend this convention. And yeah, go ahead with our next one.
Okay, so basically we are going to the our next speaker is Dr. Mina Shintapali, and so I'm going to just she is a founder and the past CEO of A through Z Pediatrics. She retired in December 2018, 2019, January. She's a master trainer of PEC PDS 0 to 3 Neurocognitive Science, Texas, and ITSN specialist through CLI Engage. She's also the CEO of Psy Institute of Educare. So Dr. Shintapali actually is in San Antonio. You look too young to retire, Dr. Shintapali. Anyway, her topic is 0 to 3 years neuroplasticity, cell and impact of unrepaired relationships. This is going to be another of those very, very fantastic, and I'm looking forward to hearing this talk. So Dr. Shintapali, over to you.
Unmute Dr. Shintapali Vijaya and go ahead, put your presentation, Dr. Shintapali. Can you unmute Dr. Shintapali Vijaya?
Yeah, she can do it on her own. I tried to do it.
Okay. Am I unmuted?
Yeah, you are.
Sorry, the slides are slipping through. So thank you, Anupama and Amit Chakraborty, for giving me this opportunity. This has been my passion actually since 1979, when I first saw a kid with psychosocial dwarfism. Then the Brazelton scales and touch points have been evolving. And with the emotional deprivation, he was a 3.5-year-old who almost behaved like an animal and walked up and down the stairs at nighttime, ate raw meat, and wasn't having a single phoneme and was not looking at people. But when we placed him in a very nurturing Christian family, he started making eye contact. He started getting telegraphic phrases. And then I was amazed, and as Dr. Moni has described, it was I was convinced that we had to stop the hypothalamic pituitary adrenal Hpa axis and unopposed work of alpha adrenergic system inside the brain and in the rest of the systems, causing this global delay. And I never gave that mission and vision. And I brought all research together and I integrated into my primary care practice, whether it was a trauma after extreme low birth weight, whether it was a trauma because of domestic violence and exposure to stress and trauma. I've been able to connect the networks, and I was amazed to see the 1997, the Roundtable Symposium from Johnson & Johnson Institute about the Hutton-Locker's research, Harry Tugani's research, Patricia Cole's, and I integrated all that, and I successfully treated many autistic kids took out of the box, and Nicu graduates, extreme low birth weight. They are going to college today. I have testimonials. And so I was never in an academic setup to do this. So my top, yes, sir.
Dr. Shintapali, Dr. Shintapali, 1 second. Dr. Anand, could you unshare your screen so that Dr. Shintapali can share her screen, please? Thank you.
So coming to this aim and getting this opportunity of reaching out to many primary care as well as research is that it is our greatest opportunities and a turf of the pediatrician and the family practitioner to bring the networks together, the most opportune time when 90% of the world is connected inside the brain, mentalization in the first 3 years of life. And we can utilize the first 15 visits when we can educate the families as well as educate children to create a lifetime neural pathways through their positive experiences, and which forms a primary structure. And if it is strong, we will not see the shaken societal norms that we see right now. My objective is to, I'm sharing the screen.
Dr. Mina, can you share your screen?
I am sharing the screen.
We
unless
don't see your screen. No, we don't see your screen.
We don't see your screen.
You know.
You don't see your slides.
Okay.
Click on
There is a green button on the top.
Okay. Sorry. I'm losing time. Okay.
There you go. That's perfect. Yes.
Thank you.
Awesome.
So I have no financial incentives, although I'm an author since 2004 on how to integrate sciences in the curriculum. This one is blocking me here. 1 second. So the guiding questions here are, what if everybody in the whole world, adults who take care of the children, anybody who's involved with taking care of the child, the extended families, the teachers, the physicians, everybody learned about having an understanding of the nature of the nurture and the positive experiences and the impact that can be given to the children and build up the resilience and the protective factors in the relationships. How come, what is an opportunity for us to do the preventive care for all the children with this criteria and guided by that? And so I want to have an emotional impact, not only intellectual impact, in understanding neural plasticity and the relationships. I have this screen coming in my way for some reason. How can I prevent this? Okay. So there are theories of just early child development. We always knew suppression amblyopia causes blindness if you didn't care for it by 12 months of age. We knew congenital cataracts cause some blindness if you didn't take care of it. We knew if there was a sensory neural hearing loss, the children didn't grow. But then we couldn't explain it in the way the brain connects with the world through the 5 senses. But we have had psychological studies like Mary Ainsworth, the attachment and the insecure attachments, Maslow's theory of hierarchy, Erickson's trust and mistrust. I don't have time to go into the details. Bandura's social learning theory and Vygotsky's Social-cultural theory, the culture has a major impact in the way of raising children and its impact on the outcomes. Gardner's multiple intelligence theory and neophysiation, 3 stages of development. So the dynamic brain growth explains all these theories, because now we can have imaging studies, we can measure voxel diffusion tensor imaging, voxel-based anisotropy studies, where we can actually measure the axon volumes, the glial thickness, as well as the activity, functional activity of the brain. Parents are the architects of this brain that can leave a definite impact and a permanent architecture, and we need to reach out to them so we can hopefully change the world. Here is I'm not going to go into the details. I'm going to say what Sai Baba always said: when there is righteousness in the heart, which is the microsystem and the mesosystem contact the family and its connections with the community, which is the mesosystem, the faith system. When there is righteousness in the heart, there is a beauty in the character, and there is harmony in the home. If there is harmony here, there is order in the society. And this harmony, this character can be impacted by the politics, the employment and the political decisions, the wars, and so on. What we see today from the impact of COVID, we will see it as a chronos system, not today, but 3 years from now, we're going to see the impact. And Maslow's theory of hierarchy, where the physiology of a child, the physiological adaptation is very, very important, which is the fundamental basis of whether there is a survival mode or a thriving mode that establishes security or insecurity. And then that leads to social connections, because they feel secure and safe. Whether we put self-motivation, self-esteem, or a guilt and withdrawal is all dependent on this, the base of the triangle. So what are we talking about when we're talking about learning? The learning is through the 5 senses. The kid didn't have any learning. Everything is novel when the child is born. And now epigenetics really say the good genes do not get expressed unless, or get turned on, unless the environment promotes it. And bad genes do not get expressed if environment prevents it. So physical health is very important. We need to have gross motor, fine motor functions, coordination. Food insecurity should not be there. 1/3 of the population, the children go to school with the food insecurity and hungry, and they grow up with the hunger too. And physical ability to exercise is very, very important. Immunizations are important. If there is a physical disability, that also interferes unless the inclusion criteria make them learn to the maximum. Language is a culture. Without a language, we are not what we are. And there is no difference between a subhuman level and us. We need to promote expressive language, written language, the comprehension, language comprehension, emergent literacy, where there is a meaning for print, where there is a child learns to read and then they read to learn about, from whole of phrase of mama, dada, baba, to telegraph phrase like a lunch. And by 18 to 24 months, they have anywhere from 100 words in simple sentences, syntax at 18 months to 24 months, they have pragmatics and 600 words. That is doable. But the basis for all of this is social emotional learning, where the child has to identify himself with a sense of worth, the self-respect, security, and identity, self-awareness, and emotional intelligence of finding his emotions and the emotions of the others, and able to regulate the emotions in a proper way. And pro-social behaviors come from all of these to establish relationships with the superiors, the teachers, the community, the family interrelationship, so they could do effective problem solving. And social emotional learning is basis for cognitive flexibility, cognitive associations, and the executive function that we need to see, which is a human territory. So everything is a cascading effect. Parents take care of the infants, and the parents are taken care of by professionals and their relationships, and it has to be all towards positive experience in a state of security, trust, relational bonding, and positive relationships. So that's what we're going to talk about in social emotional learning. And what is this social emotional learning? It is a process. It is a process of integrating what you learn from your experience to build skills and knowledge and attitudes. And this is a lifelong process, 0 to 3, 90%, up to 5 years, 100% experience expectant behavior. Experience dependent is going to be later on, but this experience expected behavior is like a digital analog through the 5 senses, the software. We are going to create broadbands. If these broadbands are thicker, faster is the transmission for reading, learning, identity, insecurity, and so on. So let's talk about this little story to give a visual picture of how this dependent responsive parenting works. Once upon a time, the wolf was walking down thinking it's great and meets a rabbit and says, who's the strongest in the forest? So this uncertain bunny afraid says, you. And then the pride increases for the wolf, and walking in the forest meets a little Red Robin Hood. And then that girl also says, Mr. Wolf, you are the greatest. And so he's all thinking, I'm the greatest and I love myself and the king of the forest, and meets a little tiny cute dragon, baby dragon. And says, who is the greatest of all? And he says, my mommy, of course. And then he shows all the anger and calls him stupid artichoke, little artichoke. Who is the strongest? Tell again. And the baby was unmoved, unnerved. Then says, I told you, my mommy is the greatest strength behind me and the caring person. And the wolf looks at the big dragon standing there and walks away. And so what can we do to get this one? In cognitive, we need the time management, the regulation, the executive faculties, audiovisual spatial reasoning, self-regulation, long-term memory, short-term memory, working active memory, focus, attention, everything. And in emotion, understanding others and also balancing our emotions. It's okay to have emotions. How do we regulate it? How do we make relationships in a work environment with the parents, with the teachers and superiors in the peer group? These are all at stake when there is a shaken attachment. And so we should raise our children with a growth mindset, which comes from Stanford University, also Drucker's, and we've been talking about it for decades. And these are the children who are not afraid to take challenges. These are the children who are not afraid at the other success, and they do not become jealous or anything. They're inspired by a criticism to work harder. The effort counts, and they face challenges. And if everybody does that, we do not feel threatened. We don't give up. In a fixed mindset, they give up. I cannot probably become a doctor, so I'm going to become whatever I want to be. I don't think I can stand. That insecurity has not to be there. Looking at this picture, you could say the baby is looking at an adult figure interacting with him. His emotions are so mature. They're born to love. They're born to live, persevere until they've attained a skill or an activity. And they have intuition, they have excellent memory, they never forget a wrong word you have said, as they're growing up. But we are borrowing adult brain to keep them happy. We are borrowing the adult prefrontal cortex to make them live and learn. And this baby is a happy baby. Look at the interaction of the mother, touching, that increases the oxytocin, and it's all our studies have been there. The bonding increases. The baby is happy, feels wanted, and is eager to learn from the environment because the baby's inherent curiosity is promoted. But what is happening here? Here is a baby crying. Can you imagine a mother holding a baby, not necessarily depressed, but everything is normal, but looking at an iPhone? Which I have seen many a times in my office space, and I won't let that happen. I would educate them in a way where they would understand why it should not be done. This baby is going to cry, and withdraw itself and say, you don't like me, you don't want me, I'm not important. Same thing with iPhones too. And then the baby will withdraw and they will stop crying and say, oh, the baby is content. But the baby withdrew the senses. And I will talk about what that insecure attachment will do for this baby in avoidance or dysregulation with ambivalence and disorganization. What do you see when you look at this baby? Petrified, amazed, scared. And this is the baby who doesn't know where I am, who is caring for me. Somebody asked about pregnancy. pregnancy, the sky would be dropping, but the pregnant lady walks slowly, is more relaxed, they're smiling, because the pregnancy causes the dopamine surging, nucleus accumbens, as well as prefrontal cortex and VTA for reinforcing the parenting skills. But if there is a postpartum depression, it has taken over to where much more similar to global anxiety disorder or depression disorder, manic depressive disorder. The networks have shown, and I've given the reference article on that, can't go into the details of that. How about Eric Kirchhoff's study on the pre-genetics? What is happening in the pregnancy? So the epigenetic factors have been studied in the pregnant woman, how it affects the neuronal proliferation, differentiation, migration, dendritic formation, axon formation in a person who is in a relaxed way, well cared for, and their self-care is better, they're not under stress. Definitely, the smooth formation of all the networks. Organogenesis happens by 4.5 months of pregnancy, but in the last trimester of pregnancy, because of the mother's emotions, they start axonal sprouting. But this is affecting the mother who has gone in different ways. It does affect the genetic factors, but till today, no single genetic factor has been affiliated with autism spectrum disorder or ADHD or any neurodevelopmental disorder. So other than Fragile X and Downs and other deletion syndromes, specific mosaicism. So we have to know it all started in the ovum and the sperm formation, the cocaine and drug addictions, the vaping, everything. There are studies on all of those. It's the same visual picture. That's a good article. I would recommend everybody to read that. So we have to take care of the pregnant woman, and we have to engage the epistemic trust so that they open up with us if there are challenges in life. And so it's all about like a fiber. We are talking about prefrontal cortex, the amygdala, the hippocampus with uncus and amygdala, temporal parietal, hypothalamus, pituitary adrenal axis. This is fiber. That's what we call. A visual picture of the inequities, minorities, where there are no opportunities. It is deep rooted into the community, adverse community experiences. And kids in Chicago and Bronx and even northwest to San Antonio, they can't go out because there is so much of violence. We want green spaces for them, but when they go, so many African American kids were misunderstood and they have been murdered. And at a family level, there are emotional neglect, divorce, incarceration, mental illness, homelessness. At an individual level, mother and father substance use disorder, depression, schizophrenia, substance abuse, domestic violence. Besides these risk factors, lack of knowledge of how to connect the senses to the prefrontal cortex is a very important issue. You could have a chromosomal disorder, but you can optimize, because John J. Ratey has very well proved that cells grow, the pathways grow around 6 centers. You have to focus on the 70 billion cells in extreme low birth weight infants. So the electronics have a double dipper. They cause the scarring of the brain. So here we only have 5 senses. Bottom up is going into the frontal cortex. If the affective is one of insecurity, detachment, apathy, then there won't be any forward movement to the prefrontal cortex. They get arrested at amygdala. But if everything is smooth and well supported, they make top-down connections. So here is a visual picture of a 1-month-old where the brain is nothing but that. This is a courtesy of Dr. Harry T. Chugani. I contacted him. We talked about the perfusion scans that he did. He said, Dr. Shintapali, you're right. If you're going to use it, use it. I give you my permission. He gave a written permission. So I've been using it since 97. 100 billion cells. Even if there was a trauma in Nicu, extreme low birth weight, I banked upon the 70 to 80 billion cells that were remaining. And between this 1 month of eating, pooping, and sleeping, If the baby doesn't have an attachment, if you saw the mother looking at iPhone or away from the baby because of her own insecurities and intergenerational trauma, that baby doesn't connect well to the amygdala and uncus here. Unless uncus is the one that propels the pathways in a state of security and safety to the prefrontal cortex, which is the social brain. Whereas this can, if the baby cries and is not attended to, that baby will withdraw the senses. They don't look at the parent, they don't turn towards the sound, and you can detect these red flags as soon as 1 month to 3 months transition. And if the baby is well cared for, they're smiling, their social smile comes a lot earlier than 3 weeks or 2 weeks, and they start making cooing sounds, they stow chest up. And there is a curriculum that I developed, to stimulate the language as well as the motor system, as well as the eye tracking and the hearing from left to right to right to left, and the kinesthetics. And then this baby is secure. Now he's going to learn, he's going to develop motor skills, symmetrotonic reflexes are released, and social brain connection is the rapid transition. If that social brain is now up until this time, we want you to let the baby cry and hold. If the baby is always held and not let cry, that baby is a vulnerable child. But now we have to shift to how to treat the separation anxiety, how to treat the stranger anxiety, what kind of foods I should feed so that this baby won't really eat sweet foods and develop obesity. Food shouldn't be an answer for him. How do I redirect him from his stress? Babies cry because they're stressed out. They don't know how to explain. We borrow the adult brain to look at what is mentalization of the child's brain. And so we connect them. So we need to connect them with the redirection, with the phonics, numbers. Child learns every single day, 24/7, 365 in active, quiet, alert state. And that is the role of the parent, to sit one-to-one relational bonding. This is the time when children cry, they're being handed over iPhones. That has a major impact of overstimulation and no purpose, because it is the procedural memory, declarative memory that makes a child go and deposit into the prefrontal cortex. That doesn't happen. And so you have blunted axons and too much dendritic networks. And here is the social brain that already formed smooth transitions for in a hierarchical fashion. If anything that is disturbed here will not go over there. And these are the culprits: 100 billion cells, 10,000 connections for each synaptic proliferation through sight, sound, taste, touch, and smell, not one. When all fibers fire together, they stay together. And here is grams, 50 grams brain became a half kilogram brain by the second birthday and pruned out to an adult brain based upon used networks. What happens if you don't touch a child and you are trying to deal with your own trauma, you didn't touch, and then all of a sudden you wake up and the baby is sleeping and the baby is touched. And this is an experiment where there is no sensory integration and the baby suffers. There is no sensory integration to the frontal lobe when you only let them see a print. But when you engage them with the lexicon, there is a sensory motor cortex to the prefrontal cortex meets. So if you have VACT, visual, auditory, kinesthetic, and touch, how can the baby will connect from front to back? And I use that one to connect all the Nicu graduates. And here is a loud sounds. The parent is talking in a low tone voice and stimulating will draw much attention. Patricia Kuhl has done a lot of studies where if it's a hi baby, how are you? There won't be a response, but when it is a hi baby, good morning, you're so beautiful today, that's when they take it. So as the pitch and frequency of fights in the house go up, the child will not learn. There will be a sensory segregation. Infants differentiate phonemic presentations to the thematic presentation in the brain. And if one person for one pitch and low tone voice talks to the child, there will be a thematic presentation. But if the same person talks another language, it will be stored at a different site. But if one person speaks English, one person speaks native language, one person speaks Spanish language, they can learn 5 languages. And that is the clue. And it starts at birth. And by 5 months, the discrimination has ended. Here is something from a Wuhan study on what is the cortisol doing by gaming? 3 hours of gaming, 12 hours a week. The children have lost their frontal lobe first, and these are grown-up adolescent kids, and it is taken up by the red in the midbrain, and the reward brain has stopped. Only the negative brain, which does not respond to reward system, and brain become a prune of a brain by 4 months. And this is the diffusion tensor imaging studies by Stephanie Ames, who compared ASD, OCD, and with the controls, and ADHD. And the splenium to corpus callosum, there is lack of diffusion in the ASD and ADHD, and it's much more diverse in ADHD. Whereas in OCD, that comes as a later disease, it is not so much disturbed. So there are frontoparietal, temporoparietal, temporofrontal, occipitofrontal, corticothalamic tracts. Everything have been compromised in a different pattern, structurally and functionally in the children. And this is the same thing. I cannot see which one is, okay. This is OCD and ADHD. OCD, that is a later disease, so the prefrontal cortex is not, has a good perfusion. This is ADHD. Same thing with the, you're unable to see that, right? It's the same images, you know, it is being blocked somehow up over there in ASD. So there is a uniform study data that shows early on in the neural network formation, the brain has been affected. And this is a sequela that we are seeing. And here is a study from Eric Korchesny. It's about high volume brains, overstimulation of the brain, blunt. There is big amygdalas, a lot of glia, a lot of mini columns. These axonal growths are stunted. Neuron cell bodies increased, a lot of profuse dendrites, but they have not had procedural or declarative memory that has gone to the prefrontal cortex. And we see this, the electronics can do a lot of this overstimulation besides the epigenetic factors. Same thing. So in secure attachments, the secure attachment is where there is a nurture, there is safety, there is trust, there is motivation, a good parent, responsive parenting, a child lives and interacts, mother takes the cue and she works with the child all through the day in all domains of learning. Whereas in insecure attachment, where the parent comes sometime, the parent doesn't come other time, and then have neglected the parent, there is avoidance. The child doesn't look at the parent, even as early as 3 months old, 4 months old, 6 months old. I've detected that. And then there is a confused ambivalent, you know, that there is some abuse or some neglect, that the child runs to the parent, but runs away from the parent. This happens in inconsistent parenting. In disorganized parenting, where the child is aggressive, unruly, very disorganized, this is from abuse, trauma, and we know that from various causes that we have shown. So what happens with the homeostasis? We eat or drink or anything we excrete in the same way. When there is a little motor vehicle accident, for instance, and you're shook up, or somebody got sick, you're shook up, your homeostasis comes back to normal baseline within a few hours to a few days, within a week. When there is a vigilance that, you know, you're driving a car, you've been hit and you're making a left turn, it wasn't your fault and your car is totaled, it takes a longer time for you to come back to your homeostasis. It takes longer. And this vigilance gets better because you reassure yourself you're okay. But what about watching vicarious or a direct trauma or rape or incest or severe flooding, losing home, and it's so impacting? They go through freezing dissociation. Girls usually dissociate, they faint, and they're in la-la world. That is because of the oxytocin is high in them, and that's why they're missed as ASD early on. And there is now an argument that, boys and girls have equal amount of ASD because it's a spectrum. It's not the only 3 domains. And so we miss them even in with the ADHD in attention because they're not hyper. But boys who have freezing hypervigilance, they're in a frozen state, they never come back to normal. They are oppositional, they're rude, they're hyper aroused, they have explosive temper, and they're the characteristics of ADHD, we catch them early. So all of these are because of the autonomic nervous system, whereas just like the brain gets, just like the muscle gets burned with the steroid use in athletes, the brain gets burned with the cortisol, it burns. Actually, it causes apoptosis. 600,000 cells per minute die away, whereas when you're really firing it together, it's only 250,000 when there is sensory integration, the 10,000 connection cells per minute. So there is a fixed dilated pupils, Sakatobo syndrome, which is cardiomyopathy from stress. If you're an athlete working out, but if it is induced with the stress of being somebody, that has an effect on the heart. But if it is a sudden stress, it could be reversible. But if it is sudden, reoccurring, long-term amplitude of stress, that it is irreversible, and they balloon out and they collapse while they're playing. Happened to Rajkumar and happened to the cricket player Sridhar. Your stomach is disturbed, you get duodenal ulcer, you get reflux disorder, you get irritable bowel syndrome, your gluconeogenesis is high, but a word about the leptins and lutins that are manufactured here to do the BNDF stimulation also interferes with the arborization in the brain when there is so much of stress and fatty degeneration of the liver because of either overeating, undereating, bulimia, or anorexia. And this forms the basis for high gluconeogenesis from the epinephrine, norepinephrine, cortisol, leading to obesity, acanthosis nigricans, and diabetes too. Physical disorders, kidneys, adrenals, kidney dysfunction is secondary to hypertension, but hypertension is the cause from the stress, chronic stress. Sexual dysfunction in adults, but I've seen tons and tons of kids who don't talk about it unless you ask, with the enuresis and encopresis. And so we have to make this autonomic overdrive from sympathetic into the parasympathetic system. What is the effect of it? When the brain cells go through apoptosis because cortisol burned it, and my brother Sunny Anand made my life easy because the studies do show cortisol is the one, a culprit, where there is a brain scarring. And this scarred brain, you are trying to make them follow through mental health therapies and everything, unless they feel within themselves that they are safe and secure. Putting them in a foster home, moving from foster home to foster home, is not going to help. This is a 4-year-old, Dr. Chugani shared, a smooth transition to the prefrontal cortex, amygdala and uncus. But this is, Adrian Rainey did this, Tyker did this, as well as, this is Dr. Chugani's original study. The brain is scarred, and in the scarred brain areas are the dopamine and serotonin receptors that are learning hormones and happiness hormones that are not seen. And we have to, when we can rewire them after the 5th birthday, there are thin wires. And so it can be done. Experience it, I worked on that. So I'm going to skip this one. And so what does this child mean to you when he looks at you like that? So where are we right now? This is a study from World Health Organization. 40%, well, the autism spectrum has moved up to 1 in 44 now. 40% of the population have 1 or 2 mental disorders. 22% have a severe mental disorder. 8.3% have anxiety disorder, but 31.9% are from 6-year-olds. Behavior disorder, 9.6%. So 1 out of 10 have a problem, but they're 2 out of 20 when it comes to older age group, 11 years. Mood disorders, depression, anxiety, anorexia nervosa, 14.3%. And 1 out of 4 children live with a behavioral health disorder. 15% of them mild to moderate, 5% are severe. 1 out of 4 by 16 years have faced ACEs, and they're living with the not thriving, but adapting to live under pressure. 48% of the girls 18 to 34 years have been physically abused, and they're facing their own trauma and no self-care unless somebody has developed an epistemic trust with them and they can make them talk about those, are raising kids. And so where is the child going to learn? From mild trauma to ACE, where there is no support system, they live with a complex trauma from various other causes that are shown in the Wendel's tree. Poor self-respect, no trust, guilt, shame, poor relationships. And they move from foster care to foster care to foster care. Now there are some people who don't even want to accept them because there are 200 children in Texas without a foster placement out of the 4,000 who are under CPS services. Stress can be positive, that can teach you how to cope up and build up your strategies to use that as an opportunity, because there is a family support, because there is a mentor, there is no food insecurity, there is no discrimination, there is no racial overtones. But moderate stress, unless the support systems are there, will definitely go into toxic stress where they are exposed to drugs, alcohol, substance use disorder, rape, domestic violence, vicarious and direct involvement. And these are the kids that have an overlap. We see for ADHD, unless I have an epistemic trust with the parent as well as the child, I cannot bring it out that there is a stress. Then I have to work my way up to handling the trauma of the dyadic approach. I have to teach the mother self-help skills as well as the child. Then if it goes to PTSD to developmental trauma disorder from complex trauma disorder, and the difference is apathy, hopelessness, helplessness, either being irritated and kill people like in the Oxford School or many schools, or commit suicide or withdraw. So I'm not going to go into the individual details because I'm short of time now. What did COVID do? COVID increased the depression by 26%. Anxiety, which is already 39% in 6-year-olds, is 45%. Food insecurity, employment insecurity, stress of wearing a mask and going, and the infants not able to read the lips in the Head Start programs in the daycare centers. Even if you get to wear a clear mask, it's something that prevents, because children watch the adult and they imitate the adult through the mirror image themselves. The stress increased by 38%. C-sections have increased without any help in that. And I think we're coming out of that. And so we're going to see the impact in the long run. What can we do? We have to do a holistic approach where we are going to talk about pregnancy nutrition and immune boosters, brain boosters. We need to talk to the parents about the normal newborn experiences. How can they really make the child hear from the right side, left side, and deposit the messages into the prefrontal cortex, for which they need a secure attachment. That secure attachment comes with the adult caretaking. We have to have a goal setting to reach that goal. Emotion should be understood by every adult and regulate the emotions. Then we need to work with the adults on these. So I borrow adult brain. I always borrowed adult brain to take care of the child, not to have the impact of trauma. And I succeeded. I had unflinching success on that. Love, sympathy, and empathy, and good character, and Bronfenbrenner circle. We need to get out of this, and we need to take that mother where we establish a trust and say, Mom, how can I help you? These are the, so what I did was, you cannot directly confront it. I used to have a chart of a scarred brain, failed networks, healthy brain, and it said, this is all done by 5 years. Do you want to share something with me? These are the circumstances. I can help you from that end. I can help you where your child is, why he's acting out by not eating. A lot of people don't realize there is a physiological anorexia, and they don't have patience to really tell a story and let the child eat, imitate the adults sitting together and eating. The meal time has not become a family time. Children suffer because of that. And then they show an iPad, and that is overstimulating the brain. And definitely I have seen language delay and autism spectrum behaviors. I have to reverse them. If there is time, I'll show a video. So we do not know the magnitude of the of this impact. We do not know the underlying chromosomes, but epigenetics tell me I need to stabilize the environment the child is growing in. And so what if we can identify these between 1 to 3 months to 3 to 6 months? I did that. I'm sharing that. I'm writing a manual on that. And we need to support the adult education. Every teacher, every parent, every practitioner, healthcare worker, therapist, they need to know these facts. And so how can I make a child learn the language and everything? Everything that you do, you can support the language development, motor development, eye contact, games, objects, spatial reasoning, pre-math skills. We need to make them school ready. And that's why I became an ITSN specialist, so I can train as many teachers as possible. Every puzzle you do, every phonics you do, every communication you do, but not through an iPad, iPhone, TV show, or Sesame Street.
Dr. Shintapali, can we finish in 5 minutes so that we can get to some questions? Yeah, thank you.
So the consistency in the routine and the structure and understanding of the parent is the security of the child. So what is the self-care? We need to coordinate everything. So people were asking questions about it. I implemented this chart in a school project that I did for San Antonio Independent School District, 400 students in each school. All of them got better when they were using the meditation. Meditation causes with the nasal breathing technique, with the music, with the yoga and guided imagery, you increase the nascent oxygen where that causes vasodilatation. Not only that, it has a negative feedback on the epinephrine and cortisol secretions. So you're more in a relaxed state in oxytocin. And the kids, the pilot group kids were getting that, but the control group came to the pilot teacher and said, Miss, can I use that guided imagery and the breathing technique so I can calm myself? I'm really agitated. These were the ADHD kids. So the discipline problems for instead of 565, in the 2 years, they came down to 65. This was an SASD, which is very impoverished neighborhood. We have to be motivated to have positive thoughts and help ourselves. And that is a life application of positive thoughts. They discussed every day. It gives ideologies, sequential organization, stories that they read, cognitive abstract reasoning. Everything was promoted in ADHD kids. Singing always is has many moods, but we opted for like Mozart or classical or something positive value. Exercise always help, yoga to Tai Chi. And here is Andrew Newberg gave me permission in 2003 to use his stance. Meditation and Buddhist monks, he gave me the permission to use it in my teaching as well as in my books. The nasal breathing increases your prefrontal cortex perfusion, whereas your right brain, which connects with the world, is silenced. So meditation has more meaningfulness, more of prefrontal cortex affiliations. And this is my study of the kids with the ADHD, and they were above, and the kids who never passed an examination passed during the time I took volunteers and I did the yoga, the chart I have shown you. If you have to, I'm not going to go into diverse schools, scales and everything, but I could show a small videotape how children can imitate adults, okay? What is it? Okay, I'll go here. I was going to show my own. Sorry guys, I'm searching.
So if you're playing the video, you have to share that screen from the, so it might be a little difficult to do that. So,
well, you know, so I could show you something else then, you know.
Yes, please go ahead and finish within a couple of minutes because we have got several questions.
Here is a fetal alcohol syndrome. What would you say? The kid is going to be disabled, mentally retarded, you know, with the ptosis, with thin philtrum. And he came to me at 2 months for pathways. This child doesn't have anything. He talks very well. He goes to regular school. And, you know, I'm just going to briefly show. He knows everything. He's a straight A student. 5.5 years of age. This child was totally autistic. He was kicked out of daycares. He was kicked out of Head Starts. He was kicked out of the school where I did the pilot project. Then he wasn't looking at people. He was running under the sinks and everything. And he graduated, went to college, and brain networks through parent education, tone of voice, engagement with the family. See in economics. Okay, so here is a Williams syndrome, autism totally, but you know, I worked with the brain networks.
We don't see those. We don't see those pictures because it's being your only screen which is being shared is your slideshow. So
no, okay, let me.
So let us stop right there. That was an excellent talk. And really, everybody enjoyed it. And we have several questions. I think this is much more interesting because people have asked specific questions and they've congratulated you very much, including our past president, Dr. Narendra Kumar. It is a great command in this difficult topic. Dr. Brahma Sharma also said great presentation. And basically, the question from Dr. Umesh Sharma is that what percentage of these brain behavioral effects are reversible?
I think it depends upon the parent's commitment. The more the parent is committed, the more the provider trains the parent. And I didn't see, I have so many kids who are born drug withdrawal. You know, I just received a picture from a 19-year-old who is going to University of Dallas. I've seen autistic kids who, sorry. Okay, so every, you know, the more committed you are, you can minimize the morbidity. And I was going to show, I'm sorry, wait. I'm so sorry, I messed it up.
Maybe
if you want to play this video, go ahead and play this one. It's only 18 seconds video, so go ahead and play that.
This one, this is
this one, yeah. You want?
How, that was the previous one.
Okay.
So she says, clap both the hands. The child claps it. Okay. Where is it coming from? Okay.
You have to go to that the different screens. It's a little bit complicated because you have to go back to the main master and then select that screen. When you do the share screen,
okay,
you have to select.
I stopped it.
Okay. So anyway, okay. So basically, what we're going to do is you can send that clip to Vijaya, and she can include that in the when she posts the whole thing on the website. She can include that video. Okay. All right.
So or anybody can study these cases on my website, but I had to mask their faces because it's a public thing. Here I don't have to. www.mychild-educare.com. I posted these as samples because I've taken care of thousands of children.
mychild-educare.com. Please type that on the chat box while I'm asking this question. Please type that, or at the end of the talk, please type that. So Dr. Brahma Sharma asked, how much is genetic and how much epigenetics responsible? Can these kids rewire in these brains?
Yes, they can. You know, this is the one that I was showing is an example of that. And so, yes. Oh, gosh. This one. Okay. Sorry. So, yes, they can rewire. But what you can accomplish 0 to 3 years, rich networks, you cannot accomplish that thick networks when they're already older. So my role as a pediatrician is to prevent poor networks from in a hierarchical fashion, from brainstem to the prefrontal cortex. That's my role. And as a clinician, you know, I had to invest in a dyadic teaching, and it is uphill battle. But if everybody does it together, it's not an uphill battle. Now, Indian Academy of Pediatrics is interested. American Academy of Pediatrics is interested in trying to get there, whereas I was 40 years ahead of the world.
That's great. Alka Patel asks, does a newborn have enough development pain fibers, amygdala, hippocampus to experience pleasure and pain and retain those memories?
Right. They have that's what where people think a blind can raise an infant, but we have enough data to show. I showed you those. There are cells waiting to connect, and there is all these nuclei are there. Organogenesis is there, but it's the axons that make a difference. And it is the attachment and the responsive caretaking that makes a difference. It's the authoritative parenting, effective, active parenting that makes a difference. So it has to be the tone of the voice, the touch, the eye contact, and the music therapy. Everything will take it over there in a state of internal relaxation. Imagine ourselves when we are stressed out, our brain can't think. We cannot become strategic. Same thing with the baby. Their emotions mature before the baby rolled over. The emotions mature before the baby developed ulnar, palmar, grasp at 4 months, and they got rid of the symmetrotonic reflex. The baby is very, very fundamentally, there is a nice Johnson & Johnson videotape. I have it on my desktop, but I cannot show all those in the respect for time. The baby has a breast crawl. They're very sensitive to the scent of the mother. I promise you, in 44 years of my practice, I never used a colic drops. I used to teach all this so that the scent of the mother, the body warmth, the oxytocin surges were given to the infant at the time of birth. And the breastfeeding enhances not only the oxytocin in the mother and the infant, but also the stem cells, the coproantibodies, the immune antibodies, and your foods that you make a choice at 6 months, greens first, and polycomplex carbohydrates first, quinoa first. These kids don't develop obesity. In my practice, it was like that. I used to get kids who are already obese. I couldn't do anything because there were studies even in 77. If you have 1x number of fat cells, adiposity, it is, the baby can get a breast milk adiposity that will melt away. But when you have 6x, that doesn't go away. But those brain cells will eat. It's something to do with the NADPH shuttle system. But now we know ASS causes overeating. Stress itself causes gluconeogenesis, leading to diabetes.
Done. Great. That's great. We have got a few other questions, but in interest of time, we may have to stop here because Dr. Anupama has another meeting coming up at 2 o'clock. So it's an excellent presentation. Lot of kudos, lot of comments, lot of congratulations on the chat box. What I would like you to do is wait for a few minutes after this and answer those questions on the chat box. That will cover those questions and answers. People who have I would request, recording can stop, but I request Vijaya to keep the chat box open so that she can answer directly to those beautiful questions which have been asked. And unfortunately, due to interest of time, we cannot cover it. Again, I thank you and Dr. Anand for excellent presentation out of the box. I will, before I hand it over to Anupama, I'm going to announce that next month, again, second Saturday of each month, we have our sessions, and we've got fantastic sessions which will complement this. The session is, there are two speakers, Dr. Kunal Desai and Dr. Jairam Thimapuram. And they will talk on impact of heartfulness meditation on stress in times of pandemic. Preventive strategy to improve community health is one topic. The other topic is heartful meditation experience in healthcare professionals and patients. So this is something which all of us who've gone through the stresses of the last 2 years of COVID and all the other stresses we face in a day-to-day life. This is an excellent topic and really a beautiful topic to follow today's topic. Again, second Saturday of February at 12 noon Central Time. And then we have got a couple of minutes. Dr. Anupama, over to you to do the vote of thanks and close the session.
Thank you, Amit, for that wonderful moderation, keeping up all those questions. And Dr. Sunny Anand, thank you so much for the very enlightening talk and from your research experience. And Dr. Mina Shintapali, your wonderful practical experience you had in treating, managing these kids. So let me thank both of you. And Dr. Shintapali, thank you for your outstanding contributions to pediatrics and welcome you as a member of AAPI Distinguished Speakers Club. This is from AAPI, from Anupama and Amit Chakravarti, the CME committee.
Thank you.
And, Dr. Kanwaljit Sunny Anand, thank you so much for your wonderful talk and for your outstanding contributions to pediatrics. And we welcome you as member of AAPI Distinguished Speakers Club and today on February 12th, 2022. And thank you so much. And I welcome you all to come to the AAPI convention in June. We have VIP registrations, we have regular registrations. It's actively going on now, and we have very limited seating, actually only 1,000 because of the COVID restrictions, social distancing. So we would love to invite all of you to attend the conference. And the other thing what I want to announce is Dr. Shintapali has been requesting me to create a committee or a group to encourage the 0 to 3 years neurodevelopment and neurocognistics. And so if anyone is interested, please text us, email us. We are all at your, so we can create a small group and then see what we can do to improve or prevent these autistic spectrum diseases happening with the external influences. So Dr. Shintapali is very much interested to educate everyone, but I think unless we all come together, it's not possible. So she's requesting AAPI can help. So we can create a committee for that and then see if anyone is interested. Please, you can email me to the AAPI president email. And thank you all so much for your time. It's a beautiful Saturday outside and enjoy your weekend. Thank you so much.
Thank you again. One little thing, register today at rpconvention.org. AAPIconvention.org, and that I'll have Dr. Jayasha also post that again on the chat box so that people can click and join. Thank you again.
You can
See you
stay
next.
to answer the questions. Probably you can continue, but I may have to leave. So
Thank you, Anupama. Thank you, Dr. Chakraborty.
all right.
You're welcome. And like I said, please answer the questions on the chat box. Dr. Shintapali, please go to the chat box and you can answer those questions individually. And like I said, these all will be posted in the AAPI website. And your videos which you wanted to present, maybe you can send it to Vijaya and she can add that at the end of the talk. Okay, so please go ahead and answer those questions. Thanks a lot.
So I'm trying to look for